Hello friends, welcome once again to the Biology Forum. We are coming to the end of our ongoing lecture series on chemical coordination, endocrine glands and their secretions, that is the hormones. So we're going to end this entire lecture series with talk on the thyroid gland and even the parathyroid glands. So I think we should begin with the lecture. We actually get into the details, let us have a brief overview of what exactly this video is holding for you. We'll be first talking about the location of the thyroid gland, the structure of the thyroid gland, function of the thyroid hormones, the hormones secreted by the thyroid gland, disorders of secretion of the thyroid hormones, the parathyroid glands, and a passing reference to the gonads, that is the testes in males and ovaries in females, and how they contribute to our hormone pool. Yes, so we begin with the thyroid gland. When we talk of the thyroid gland, it is a bilobed gland. So you can see this is one lobe, the other lobe on either side of the windpipe or a trachea, and there is a thin flap of connective tissue which connects these two lobes, which we call as the isthmus. So technically speaking, if you see, it looks like an H-shaped gland, okay, H-shaped structure, which is on either side of our trachea. The thyroid gland is made up of follicles. When we take a cross section, you can see there are follicles. It is studded with these kind of follicles. Each follicle is composed of the follicular cells enclosing a cavity. The follicles secrete two hormones, T4 or tetraiodothyronine and T3 or triiodothyronine. In addition to these, there are special cells which we call as the C cells. These are the C cells. These secrete thyrocalcitonin hormone, which reduces the calcium ions in the blood. Iodine, remember, is needed for the synthesis of these thyroid hormones. So let us see how the thyroid hormones function in our body. T3, T4 and thyrocalcitonin are the three hormones secreted by the thyroid. It shows metabolic functions like it increases our basal metabolic rate, reduces cholesterol, and increases the rate of absorption in our gastrointestinal tract. It also shows its action on the cardiovascular system by increasing the heart rate, increasing the oxygen consumption, and also increasing blood flow. Thyroid hormones also have some developmental functions. They increase our growth rate and increase blood flow. Certain sexual functions are also come in the domain of the thyroid hormones. They help to normalize even the menstrual cycles and play a major role in calcium metabolism, basically by lowering the level of calcium ions in the blood. So you can understand the various reach of the thyroid hormones, and so what would happen if there would be a hypo or a hyper secretion of these hormones. So let us first talk about hyposecretion, that is hypothyroidism. This will happen because we already talked about iodine being an important constituent in our diet, which is required for the synthesis of the thyroid hormones. So if there is a deficiency of iodine in the diet, it leads to hyposecretion of the thyroid gland and causes hypothyroidism. What happens in it? There is an enlargement of the gland. We call this as simple goiter. If there is hypothyroidism in pregnant women, what will happen is it leads to defective development of the baby, leading to stunted growth physically, even mental retardation, a low IQ, deaf mutism, etc. This condition, when the child is having physical, mental retardation, low IQ, deaf mutism, we call that condition as cretinism. Right. Adults can suffer from hypothyroidism later on too. In such a case, what happens is, because the thyroid hormones show their action on the metabolism, here there will be lowering of the metabolism, weight gain, irregularities of the menstrual cycle, the person will feel cold and so on. So these are few of the symptoms that you get whenever there is a hyposecretion of our thyroid hormones or hypothyroidism. We need to remember simple goiter and cretinism as well. Exactly how a cretin looks. There is stunted growth physically as well as mentally. So quite a kind of a low IQ and a mental retardation. And this is how the simple goiter, can you see? This is the swelling in the neck region. We call this as simple goiter. Now we talk about hypersecretion or hyperthyroidism. What happens in this? There will be a condition called as exophthalmic goiter. So we talked about simple goiter when we were speaking of hypothyroidism, where there is a swelling in the neck region. So goiter basically means swelling of the thyroid gland, which will be seen as a swelling in the neck region. It happens even with hypersecretion, but you need to know it is characterized by protrusion of the eyeballs. There will be increased basal metabolic rate, weight loss. The patient will talk about losing weight in spite of eating well. And this disease is also called as Graves' disease. All right, so this is exactly the difference between hypothyroidism and hyperthyroidism goiter. Is one is simple goiter, the other is exophthalmic goiter, where there is protrusion of the eyeballs. That is because of deposition of fat behind the eyeballs, and there is protrusion seen. Okay. When there is thyrocalcitonin hormone, you have to remember secreted by the C cells, regulates the blood calcium levels. Right, now that we know about the thyroid gland, let us learn a little about the parathyroid glands. Parathyroid glands are two pairs of glands located on the back side of the thyroid gland, one pair each in the two lobes of the thyroid gland. As we've already discussed that the thyroid gland is a bilobed gland. So the parathyroid glands are two pairs of small glands which are placed two each on one lobe of the thyroid. So we have two pairs of parathyroid glands. The parathyroid glands secrete a protein hormone called the parathormone or parathyroid hormone. Importance is it increases the calcium levels in the blood. It acts on bones and stimulates the process of demineralization. So whenever the level of calcium ions in the blood is low, that is the time when the parathyroid glands will secrete the parathormone. It will cause demineralization of calcium from the bones so that the level of calcium in the blood increases. It stimulates also the reabsorption of calcium by the renal tubules. So the calcium that was to be excreted out through the urine, the kidney tubules will be stimulated by the parathormone to actually reabsorb these calcium ions back into the blood. So what happens is the level of calcium ions in the blood will increase. So you can understand that a parathormone or the parathyroid hormone acts as a hypercalcemic hormone, whereas when I talked about the thyroid glands, I have talked about them lowering the level of calcium, so hypocalcemic hormone. Right. Passing reference about the gonads, let's talk about the males, the testes. A pair of testes are placed in the scrotal sac of males. There are special cells called the Leydig cells or the interstitial cells in the testes which perform an endocrine function. So along with the spermatogenesis, that is a process of production of sperms, the testes have these special cells called the Leydig cells which will act as endocrine glands and they'll secrete the hormone testosterone, the androgen. What is the function of testosterone? It regulates development, maturation and functions of the male accessory sex organs, stimulates secondary sexual characters in males during puberty like muscular growth, facial and axillary hair, aggressiveness, low pitch of voice, etc. So these are all the secondary sexual characters which appear in males during puberty. So these are because of the testosterone. They also influence the male sexual behavior and also have an influence on the libido. So yes, this is exactly how the gonads, that is the testes in males, act as an endocrine gland. Similarly, in the females too, we have the ovaries, which also act as an endocrine glands. The major function of the ovaries is to produce the eggs or the ovum, but they also produce two groups of steroid hormones which are called as estrogen and progesterone. So what is the function of these? Estrogens stimulate growth and activities of the female sexual organs. Appearance of the female secondary sexual characters like high pitch of voice, mammary gland development or breast development, and also regulate the female sexual behavior. So all the secondary sexual characters that develop after puberty are because of the estrogens. The progesterone supports pregnancy. It is pro-gestation or supportive of pregnancy, a hormone which helps in that. It acts on the mammary glands also and stimulates the formation of the alveoli and helps in storing of milk, basically because after the pregnancy is done and delivery takes place, the baby needs to be fed the milk. So yes, it plays a role in that too. Exactly, we have the testes here in the scrotal sacs, right? And these are a pair of ovaries in females. So this is exactly how these, even though they are the gonads and play a major role in production of spermatogenesis and also in production of ovules, they also act as endocrine glands. So therefore, we always need a special mention of the gonads. The entire topic of discussion on endocrine glands is incomplete without a talk or a mention of the gonads. So hope you have understood the entire series on endocrine glands, the secretions, that is the hormones, and how they coordinate the various functions in our body chemically as chemical messengers. If you have any doubts, please ask your doubts in the comment section. They will be definitely answered. And if you really like the series, press the like button and do share and subscribe. Thank you so much.